Hi, I'm Jan McCleary. I'm with the Angelo Health Department. I'm the immunization coordinator, and I deal with the flu vaccine every year. A couple of things that I really want to stress to the general public is the fact that we do have a seasonal flu vaccine that comes out every year. The World Health Organization, the Center for Disease Control, and all of the labs around the world that deal with the data on the flus that are going around. Remember, the flu is out there 365 days out of the year. There are many, many different types of flu. Every year, these are studied. The ones that are causing the most illness, the most hospitalizations, and the most deaths, those are the three that make up our seasonal flu vaccine every year. It goes into production at the beginning of the year. The reason we have two of these this year is because the H1N1 situation, otherwise known as the swine flu situation, occurred after our standard seasonal flu vaccine was already in production. Now, these scientists that deal with this, the manufacturers who deal with this, have all of the guidelines. We know exactly what part of the cell on the flu virus that causes us to develop immunity. They took that same information with the H1N1 virus that they do with all of the other flu viruses. That's how they came up with a flu vaccine for it so quickly. It has met the same safety standards, the same effectiveness standards that every other vaccine that has come along has been followed and guided by. It is not any different. Now, there are two types of flu vaccines. It does not matter whether it's our seasonal flu or whether it's H1N1. We have the injectable vaccine and we have the nasal spray. The nasal spray does have a few little extra guidelines. It is a live vaccine, whereas the other one is not. The other one cannot cause you to have the flu, cannot cause you to have symptoms. It can cause redness at the site, soreness at the site, swelling at the site. It can make you feel a little sluggish for a few days. Cannot, I repeat, cannot give you the flu. However, with the nasal spray, because it is a live vaccine, it can make you have some of those symptoms. That sniffly, sneezy kind of feeling, a little scratchy throat, can make your lymph nodes swell up, can give you a headache. These are things that can happen with the actual flu mist. It is licensed for 2 years, up to 49 years. It is very good. It is very effective. It is a real treat to have children get this vaccine because they do not get an injection. They leave the office laughing and giggling because it tickles. That's a real big blessing when you give as many shots as we do at the health department. One of the other things that I wanted to let you know is, yes, there is a list. This flu virus, the H1N1, seems to have a little quirk all of its own. It seems to be affecting younger children, those preschoolers, the school age, up through college, a little more so than maybe our over 30 population, whereas that's kind of been the case scenario for so many flus in the past. Pregnant women are at the top of the list. They seem to have a few more problems, a few more issues with this particular virus. Their doctors will need to evaluate their personal situation as to whether they get the flu vaccine or not. That is between them and their doctor. As far as those children who cannot be vaccinated, it is from birth up to 6 months. Those children cannot be vaccinated. So the people on the list that are second are basically all those people who care for children that are under 6 months of age. We don't want them getting sick and passing it on to those young children. So you can see how a lot of people will fall into this category. That's really important. Grandma and Grandpa who have now taken on raising of the children. Grandma and Grandpa who keep, or aunts and uncles who keep the children after school. Lots of people fall into this category now where they are the caregivers. Healthcare and emergency providers, as you can see, are always going to be up close to the top of the list when we have any kind of situation, whether it be flu or anything else, because we want those people as best we can to stay healthy and not have any problems, because if our healthcare providers become ill, we have an even greater problem than what we generally would have. At that point in time, we're talking about 6 months up to about 24 years old. And then we're going to add those other people in. The state has really assured us that at this point in time, they are not looking at any shortages. It's very important that you understand that this flu vaccine is exactly the same as our seasonal flu. It's meeting all of the same safety and effectiveness guidelines. And if you do fall into that category where you feel like you need one, please make every advantage and opportunity to get that vaccine to safeguard not only your health but those that are around you. If you do have any questions, we're going to have numbers for you to call, and you can always get good, solid, unbiased information. And at that point in time, I'm going to let Maria Aguilar let you know a little bit about what the state has to say about their sending it out.
Hello, my name is Maria Aguilar, and I'm the nurse manager at the San Angelo Health Department Nursing Division. CDC is going to ship out to the states, and from the state level, those individuals who did sign up as providers or to become providers, those are the ones that are going to be receiving the vaccine. They will be delivered in increments. The first shipments that are going to be sent out is going to be the mist, the H1N1 flu mist. After that, they will be getting weekly shipments, and the vaccine, the actual shot will be delivered after that. What else did you?
It's also important to remember that our hospitals, our clinics, our health department, pharmacies, we not only checked with local people within Tom Green County, but in the process, we also talked with the 13 surrounding counties. As you very well know, we have a lot of counties who really don't have a location for them to go to, so they do travel to San Angelo to get their medical care and to get their vaccines. So we're geared, we're ready to go for all of this. We've already been dealing with the seasonal that's been going on, and I know that some people have been a little frustrated about being able to find one. They have been very well accepted this year, so I'm really anxious that that is one of the criteria that will also happen with our H1N1, that they'll be very well accepted, and people who really feel the need for one will be able to get one. Remember, the people who signed up will be the ones who will receive it.
Right, and the shipment should start being sent out around October 15th. At this point in time, it is my understanding that nobody here in San Angelo has received their first shipment, or actually anywhere in the state of Texas. When it will be sent out, that's the only information we can give you at this point, is that it'll be around the 15th to the end of the month. We will inform the public as to who has received the vaccine. When we get the vaccine, of course, we have to hit the priority target groups first, and then at that point, we expect that the following shipments should be arriving to the providers who have signed up to become providers.
Remember, Ms. Aguilar said that the first shipment going out to everybody will be the flu mist. Remember when I spoke a while ago about the criteria, 2 years up to 49? So if you don't fall in that category, as so many of us don't, remember, it doesn't mean you're not going to get one. It just means that that's the first shipment they're going to make available. We'll try to meet everybody's need who qualifies for that vaccine. And then when the injectables come in, we'll meet those guidelines also. Remember, in our area, I know that we're already in flu season, but really and truthfully, our peak flu season is in February. So that's really important to remember, to not let your guard down after the first of the year, after the holidays are over. Remember, we still have weeks upon weeks of the flu season that will still be ahead of us. It also takes 2 weeks after you get your vaccine for it to be 100% effective. Okay?